Hello everyone and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Vanessa Alford. I'm part of the support team at Ovarian Cancer Australia. I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respects to elders past and present. I'd also like to acknowledge and thank Telematics for providing us with the funding to deliver this project. The focus of this webinar will be on exercise and cancer. We have two incredible presenters who are going to share some valuable information with you. The webinar is interactive, so over the next hour you can ask questions to the presenters who are going to share, you can ask questions to the presenters by typing into the chat box at the bottom left-hand corner of your screen. Questions will be answered at the end of each speaker's presentation. Please note that presenters cannot address individual medical cases. If you have a particular question, please call the Ovarian Cancer Australia Information and Support line on 1300 660 334. This webinar is being recorded live and will be posted on the Ovarian Cancer Australia website. If you're having trouble with the sound, you can dial the 1800 number listed in the chat box. So I'm now extremely privileged to introduce our presenters to you. Our first presenter is Associate Professor Prue Cormie. Associate Professor Cormie is an accredited exercise physiologist whose research and clinical work focuses on the role of exercise in the management of cancer. Her track record includes over $9 million in competitive research grant funding and over 70 reference publications. Prue is the inaugural chair of the Clinical Oncology Society of Australia Exercise Cancer Group and the lead author on the COSA position statement on exercise in cancer care. Associate Professor Cormie aims to enhance the lives of people with cancer through innovative research and effectively transferring research into practice. Our second presenter is Julie Vickers. Julie is a 62-year-old lady who was diagnosed with stage 3 primary peritoneal cancer in April 2015 at the age of 59. I'd like to highlight that Ovarian Cancer Australia supports women with fallopian tube, primary peritoneal cancer and ovarian cancer. These names may be used interchangeably by medical specialists and the treatment is the same. Julie has recently undergone radiation therapy to treat a recurrence. Exercise has been extremely important to her since being diagnosed. Since participating in regular physical activity, she says she has never felt stronger and is very grateful to feel so well 3.5 years after her diagnosis. So I'd like to now hand it over to Associate Professor Prue Cormie.
Thank you very much, Vanessa. It's my great pleasure to be able to be involved with this webinar and have an opportunity to talk to you today about the use of exercise as medicine for ovarian cancer. So why should we exercise? Well, based on what the science tells us, exercise is one of the best medicines you can take in addition to your standard cancer therapies. And that's because we know that exercise can help minimize the functional impairments associated with cancer treatment, is the best medicine to counteract cancer-related fatigue. It helps to relieve mental distress and the stress associated with the diagnosis and treatment of cancer. And what we know from a considerable body of research is that exercise actually helps to improve people's quality of life. And that's over not just physical domains, but also about mental well-being and social well-being. Now we know from this body of research that exercise, when it's appropriately prescribed and appropriately delivered, is safe for people with cancer, both during their treatments and also after your treatments as well. Now what we can also see from the science is that exercise may actually help you tolerate the treatments that you're going through. We know that people who are undergoing chemotherapy and are exercising can actually tolerate greater dosages of that chemotherapy. And there's some very early evidence from the research literature that suggests that exercise may be doing something in terms of preventing the cancer from spreading throughout the body as aggressively as it may do. Now, if you look at all of these effects, it's absolutely undoubtable that if the effects of exercise could be encapsulated into a pill, it would be demanded by every single cancer patient, it would be prescribed by every single cancer doctor and nurse, and it would be subsidised by government. Now, the sad fact is that we can't just take exercise, you have to do exercise. So that makes it a little bit more difficult. But when we actually look at the evidence base around the effects of exercise, we know that it's probably the most effective medicine you can take in addition to your cancer therapy. Now, what do I actually mean by thinking about exercise as a medicine? We all know that exercise is good for us, right? And it's good for everybody, irrespective if you have ovarian cancer or not. What do I mean by exercise medicine? Well, as an exercise physiologist and a scientist, I've spent a lot of time investigating what happens inside our bodies when we exercise. And exercise specialists can use this knowledge of understanding what happens to our body systems when we exercise, prescribe exercise in the same way that any doctor prescribes any kind of medication. So we're talking about a very specific type of exercise at a precise intensity, which is how hard that exercise is, and also at a volume, which is how much that exercise you have to do. And that's based on the changes that we need to see within our body to realise some sort of health benefit. And that health benefit can vary depending on what outcome you're after. Now, if we would love to think that we can encapsulate the effects of exercise into a pill, but that will never happen. And that's unfortunate, but the reason why that will never happen is because exercise positively influences the structure and the function of virtually all of our body systems at the same time. And there's really no other therapy or medication that can positively influence as many body systems as exercise can. Now, in the same way that you wouldn't be taking an antihistamine to treat your ovarian cancer, we can use very specific types of exercise to realise very specific types of health benefits. In this way, we can prescribe certain exercise. We can tailor that exercise to the outcomes that we may want, whether that's preventing fatigue or helping maintain muscle mass or a favourable body composition. And we can also individualise that exercise in the same way that certain types of medicines can be individualised for people. So while we know that any activity is good for us and any exercise you can do is very good, if we take the view that exercise is a medicine, we can maximise the potential health benefits there will be to counteract the negative effects of cancer and its treatment. Now, if we can do that, we really see that exercise should be prescribed as a standard component of cancer care. And this is really what we're calling for with all the cancer doctors and nurses and other health professionals involved with the care of anybody who has cancer. And that is to think about exercise as an important medicine that goes alongside the surgery, the chemotherapy, potential radiotherapy or immunotherapies that you may be going through. And to actually prescribe exercise specifically to help counteract the negative side effects of the treatments that you'll be going through. Now, of course, I'm going to say this because I love exercise. I'm an exercise tragic. I spend a lot of time actually researching exercise. But it's not just my view. This is the view of the peak professional body in Australia that represents all the health professionals involved with the care of people with cancer, so doctors, nurses, psychologists, and therapists and pharmacists and so on. And it's the position of this full organisation to say that exercise should be viewed as a standard component of cancer care. And it really calls on all the doctors involved with your care to actually discuss exercise as part of that treatment plan and to specifically counteract the side effects of the treatment. To actually prescribe exercise as part of the treatment plan, to say that all of these treatments were very effective at helping to slow the growth of your cancer, but they can cause other negative side effects. We can prescribe exercise to help minimise the impact of those negative side effects on your life. And the COSA's position statement and the organisation also calls for best practice care to include referral to an exercise specialist who's got experience working with people with cancer, and they're accredited exercise physiologists or physiotherapists. So this is really the why of what we should, or why we should be exercising and why we should be incorporating exercise into a standard component of cancer care. But if we were to actually do this, if we were to prescribe exercise to each of you guys as part of your ovarian cancer treatment, what exactly is that prescription and how do you fill it? Well, we work off what's called evidence-based guidelines, and this is a summary of all the scientific literature to date, all the research that's done to figure out exactly what we should be recommending you guys to do to realise the most benefit from exercise in terms of preventing the negative side effects of cancer and its treatment. And these guidelines, first of all, saying with as much as possible, if you can avoid inactivity, that's going to be very beneficial to help in the management of your ovarian cancer. So what does that mean, avoid inactivity? It's really meaning just being as physically active as you can be, given the fact that you're going through some very difficult treatments and that may cause a lot of health issues and functional things that you may not be able to do that you used to do. So just trying to be as physically active as your current condition and your ability allows. And that may be, at one stage, it might be just getting up off the couch and going for a walk to the mailbox. And for another person, that may be, at their stage of treatment, that may be going for a 30-minute brisk walk around the neighbourhood, and that varies depending on who you are, but as much as possible to avoid inactivity. Now, these guidelines also say that if you want to maximise what we call the therapeutic effect of exercise, and that means what's the health benefit of exercise to your body and your overall well-being, then it's attempting to work towards, and if you can achieve it, try and maintain participation in regular aerobic and resistance exercise. Now, these numbers here are the levels or the targets that come out of this scientific literature. And they may seem extremely out of reach for a lot of people. So remember that this is just a target that you can be progressing towards steadily. But what do these numbers mean? So 150 minutes of a moderate intensity aerobic exercise means a brisk 30-minute walk on 5 days a week. Now, moderate intensity is very key here. Now, intensity is basically how hard that exercise is or how difficult it is. Now, this means that a moderate intensity is something that you'll have to be walking like you're late for a very important appointment. So instead of walking along with a chihuahua, think about being pulled along by a German shepherd. So your heart will have to be beating, you'll be puffing, you won't be, unless you're Beyonce and you can sing and dance at the same time, you won't be able to maintain a normal conversation. It'll be a bit disjointed. And you will feel a little bit tired afterwards. Now, that's what we talk about for aerobic exercise. So it's things like walking, riding a bike or cycling in a gym, swimming and so on. Now, in addition to this, and what's so often overlooked when we're talking about adhering with exercise guidelines is what we call resistance exercise. Now, that's lifting weights. It doesn't necessarily have to be in a gym. It can be at home, it can be in the park, it can be all sorts of places. But typically speaking, that's lifting weights using the major muscle groups in your body. Now, the recommendations suggest that a target of 2 to 3 exercise sessions each week with the lifting weights at a moderate intensity involving about 6 to 8 exercises. So that works out to around a 30 to 45 minute session on 2 to 3 days a week. And again, it's moderate intensity. So you need to be working quite hard so that you'll be sweating, you'll be puffing a little bit, and your heart rate will be, your heart will be beating a little bit more than it usually would. Now, as I said before, for a lot of you guys and a lot of the people that we work with, these targets are completely unattainable and really not appropriate for some people depending on where they are in their treatment phase. So the key caveat to these guidelines is they need to be individually tailored and progressed so that this actual framework of what you're trying to achieve is relevant to you, to where you are right now, and making sure that you can actually then progress towards what's attainable for you. So how do we individually tailor and progress this? What kind of considerations do we have? Well, I want to make sure that when I see you as a patient, the most important thing to me in individualising this is what's important to you, and make sure that we can use exercise in a way to achieve the goals that you want to achieve, whether that's being able to play with your children or your grandchildren or get back to work or whatever it may be. Now, after that, I go through and I consider a whole range of things that become really important in terms of making that medicine right for you. We talk about what kind of cancer you have in terms of the stage and your prognosis, what treatments you've had previously, what treatments you're going through now, and what treatments you may be having soon or coming up, and whether or not you're experiencing any symptoms and side effects to those treatments, how severe those symptoms are, and is there anything that triggers those symptoms? We also think about your functional ability. How, do you have any movements that you can't do or restrictions to your surgery or anything like that? We look at your overall health status as well. Are there other chronic diseases or issues or back pain or so on, or pelvic floor issues if you've had children? Are these things that we need to consider when making sure that that exercise prescription is right for you? In addition to this, when we individually tailor this medicine, we've also to be thinking about practical considerations. So, how often you can exercise, when you can exercise, can you incorporate it in with your daily routine, and how we can actually do that. So that's just a very short snapshot of some of the things that we think about when we're individually tailoring this exercise. So you can imagine, there's a lot of complexity there, and if you don't have any idea about what to do with exercise, or you've never exercised before, it can be very daunting to actually start this and understand what's safe for you and what's the most appropriate thing to do for you. So in terms of being able to individually prescribe this, you really need to see the right health professional. And who is this? Who's the person that should be prescribing the exercise so that it's individualized to you? That health professional is what we call an accredited exercise physiologist. Now, accredited exercise physiologist, or an exercise physiologist, or EP for short, they've actually gone through university, so 4 or 5 years. They're registered as an allied health professional, and all of their learning and their professional development has been focused on understanding how to use exercise as a medicine to help patients who have chronic diseases. Now, in Australia, there's over 5,000 exercise physiologists practicing throughout the country, and most of these are in community-based organisations, so not necessarily in the hospital, but out in your local area. Sometimes it's hard to find or know who these people are, and there's a website where you can actually go to, which is called Exercise and Sports Science Australia, which is the accrediting body. You can click on that link there, and you can pop in your postcode and find somebody close to you. Now, unfortunately, not everybody has experience in cancer, and not everyone will have experience with working with people who have ovarian cancer. So if you're interested in finding out who's the right person to talk to, or understanding how they can try and upskill or get a little bit more information about that, just reach out to Ovarian Cancer Australia and we can provide you with some information there. So if you go through this whole process, say, yes, I'm going to exercise, I'm going to see the right person, how much is this actually going to cost you? Well, the good news is that there's benefits available through Medicare and a subsidised plan that you can actually use to access the services of exercise physiologists. Now, that's through the Enhanced Primary Care Plan, and that's actually you have to go to your GP to ask for an Enhanced Primary Care Plan to see an exercise physiologist. So if your GP can do that and refer you on to an exercise physiologist, you'll be able to have a reduction in the cost of that individual consult, so it may cost something around $10 for you. In addition to this, if you have private health insurance, there's over 30 private health insurers now that subsidise the cost of actually going to see an exercise physiologist, and the level of subsidy changes all the time depending on who you're with and what level of coverage you have. But if you have a conversation with an exercise physiologist, they'll be able to give you all the information you need about accessing those discounts. Now, while we do think about this as an extra cost, and I understand how cost is a big issue, and we certainly see that there's a lot of extra costs associated with going through cancer, I'd just challenge you to reframe this thought of exercise being an additional cost as actually being an investment, and an investment that comes with additional health benefits, not just to your physical and mental well-being, your actual cancer, helping to manage your cancer, but it's also about then managing other chronic diseases or issues you may have had previously. I certainly consider my exercise as my health insurance policy, and I would venture a guess that exercise is probably the most effective health insurance policy you can invest in. So if you do all this and you say, yes, I still want to go, I'm going to pay, I'm going to get the subsidy, would you actually be able to do exercise and enough exercise to generate a physical benefit? I think a lot of people are scared about doing exercise and not sure whether they can and whether they're capable of exercising enough to get a benefit. But what we can see is people who have never exercised before or aren't exercising a lot when they come to see us, they actually can and do adhere to exercise. So they can come up and actually work through a program that involves 2 to 3 days a week of clinic-based exercise programs, and they turn up 80 to 90% of the time. And only about 10% of people can drop out over those 6 months. So even though it seems very scary at the start, and a lot of people will be scared at the start, you can do this, and a lot of people have confirmed that that's the case. Another question that may happen is, you know, like, I feel so unwell, can I actually do this, first of all? And if I do it, will I respond to it? Will this medicine be beneficial to me? Well, what we actually see from the research that we've been doing involving hundreds of people with cancer is that it's actually the people who have the worst symptoms, or so they're experiencing the highest level of fatigue or the worst functional impairments or the highest level of psychological stress, they actually benefit the most from getting involved in an exercise program. So even though you may feel that you may not be able to exercise, you're the exact person that will actually benefit the most from getting involved in exercise. So what is the best way to do this? What's the most effective approach? From the research evidence, it really starts by being supervised by the right person, and that's an accredited exercise physiologist. If you can do your exercise somewhere that is close to your home or your work or your childcare or your school arrangement, and that is really important so you can maintain this as a normal lifestyle behaviour. And if you get the option to actually be engaged with a group of people who have cancer, not necessarily ovarian cancer, we've seen from a lot of research this can be very beneficial in terms of helping you continue to exercise and then also benefit from the interactions that you have with everyone within the group. Now, can this actually be done? And I think this is a really important question. We don't want to just refer to the science and think about this in a theoretical point of view, but can we operationalise this? Well, the answer to this question is yes, we can, and we are doing that. And that's through a program called XMed Cancer, which really takes everything we know from the scientific literature and our clinical practice and puts it into the one package. But it's not just telling you to exercise, but it's actually providing the support and the resources and the structure that you need to learn how to exercise, what to do, how do you actually do this long term by yourself. And you can actually then realise very significant health benefits during this program. Supervised by the right kind of person, an upskilled exercise physiologist, and it runs throughout a range of different sites here in Melbourne, and we're expanding it throughout Australia in the next year or so. And I suppose I could talk all day about exercise, but I think what I'd like to do is try and give you a bit of a flavour of some of the benefits that exercise can have with people with cancer. And we have one of our patients involved with this video that I'll show on the next slide who has ovarian cancer.
I think the diagnosis of cancer was devastating.
I was shocked beyond words.
And all of a sudden my comfort area of knowing what was going to happen was gone.
To come out of a gruelling experience of chemotherapy, radiotherapy, to a world that you're not quite sure how to fit into anymore. Sorry.
Based on what the science tells us, exercise is the best medicine someone with cancer can take in addition to their standard treatments. And that's because exercise lowers the relative risk of cancer coming back, lowers the risk of dying of cancer, and it helps people tolerate their treatments so they experience fewer and less severe side effects.
I went from being a patient to living again.
I could get up in the morning now. I'm bounced out of bed in the morning now.
Getting up was a major exercise. I can now do it inside probably 10 seconds.
Mentally, it's really helped me to be more myself.
It's ridiculous, but I feel I could go and do a lot of things that I wouldn't have done in the past.
And I'm getting stronger all the time.
This project is really leading the fight to get exercise embedded in the standard component of cancer care internationally. And the data that's generated out of this project will really allow for us to change the way that we fight cancer.
The best part about it is, I think, that the time between now and whatever happens in the future, it'll be a better quality of life.
It's the missing link between cancer treatment and living a well life.
So you have just a little snapshot of some people's experience of XMed cancer. And again, if anybody's interested in this, please feel free to reach out to us or reach out to us through Ovarian Cancer Australia. Oh, sorry about that. So I think if we summarise this, I've just told you a whole bunch of ways that you may be able to engage in exercise and what we know from the science around what's the best way to do this. But really, what's the most important thing to do for you and what's the best approach for you? It really comes down to what works for you. And I would encourage you to explore this with the appropriate allied health professional. And if you're concerned about your exercise or you're not sure what to do or you just want to try and figure out what works for you, is really about going and seeking the advice of a professional. An accredited exercise physiologist that can help you figure out all these questions and make sure that the exercise prescription is right for you. So thanks very much. Very happy to take any questions you may have. And I'll just throw to Vanessa.
Thank you very much, Associate Professor Cormie, for that extremely interesting and valuable presentation. We just have a couple of questions. One is about XMed. What should I do to find out more information and register for XMed?
You can reach out to us through the website, which is www.exmedcancer.org.au. You can actually, there's a whole bunch of information there, but you can also click on the Enroll Now button and pop in your name and phone number, and we'll give you a call and talk about everything that's involved with the program. And I should say as well, if you're not, if you look at the website and you realise, look, it's not a site or a location that's convenient for me, you feel free to give us a call, and what we can do is provide a range of different resources and also a referral to an exercise physiologist who's close to your home. So we'll do the best I can to help you exercise.
Great. And one more question. Do I need permission from my treating specialist before I begin participating in exercise?
That is a really excellent question. So the answer is really no. You don't need to get a referral from your oncology team. You can actually go out and seek out the services of an exercise physiologist. Now, if you have any concern whatsoever around the safety of that exercise or what you should be doing, if you flag that with your exercise physiologist or if you flag it with your oncology or cancer team, then we can actually communicate together, and those the exercise physiologists can talk to your nurses and your doctors around your treatments and any concerns you may have. So you can actually self-refer yourself into an exercise program, whether it's XMed Cancer or seeing another exercise physiologist. You can also talk to your GP around if you don't know who to see and you're going to see your GP, you can ask them if they know any exercise physiologists in your local area. But you don't need permission from your doctors to actually start exercising.
Great, thank you very much. Thanks again, Associate Professor Cormie, for joining us on this webinar. We really appreciate your time. Just a reminder to all the viewers on the webinar, if you have any questions for our speakers, you can type them in the bottom left-hand chat box on your screen. So I would now like to bring to the microphone our second speaker, Ms. Julie Vickers.
Yeah, my name's Julie, and as you can see on the slide, I was diagnosed with stage 3C primary peritoneal cancer in 2015 when I was 59, 1st of April 2015, so April Fool's Day, which was, you know, easy to remember. And yeah, exercise is important to me, really important. I'll show you my fantastically well organised sheet of paper here that I'm working from. So, yeah, I hope it's clear enough. You know, I think I said to someone yesterday, I'm happy in my life at the moment, really happy. And exercise is part of that because it can really change my perception. if I'm feeling, you know, stressed about the cancer or anything at all, you know, fatigued, demoralised, whatever, exercise really turns that around for me. It's a real perception changer. And maybe, you know, when I was diagnosed, I wasn't particularly unhealthy, or, well, I was unhealthy, obviously, but I was reasonably fit. You know, I'd just done a 6-day trek in New Zealand. I couldn't really understand why I was the last one in every day, you know, why I was always the last person to finish the walk of the day. I was like, that's not normally me, but it was like, okay, what do you do? But I was, you know, I was using a mini tramp. I've always exercised a bit. But nothing like the level of fitness I have now. And, you know, my brother reckons I'm becoming an Iron Woman and yada, yada, yada. You know, like I really am pretty healthy now, pretty fit. When at the end of treatment, I saw my surgeon, you know, after I'd done the kind of standard, you know, chemo, I did a bit of exercise during that initial round of chemotherapy. I wish I'd known. I would have done a heap more. But at the end of treatment, my surgeon said to me, stay strong in case you need further treatment. And, you know, again, I didn't really know how exactly to do that. I would say that I have worked over the last 2.5 years with exercise physiologists, and they've been extraordinary. I've learnt so much from them, but I'll try and be a little bit organised and talk about that in a bit. When I came out of surgery, because I did, you know, chemo, surgery, then more chemo. When I came out of surgery, I went to rehab hospital because I lived up 4 flights of stairs. I lived on my own. I really didn't have anyone to look after me. And so I was lucky. I went to a rehab hospital, and that was when I started working with exercise professionals. First time I'd ever done it. They had a really brilliant physiotherapy program there. So I was about, I think, 6 or 7 days after surgery. And, you know, if you have ovarian cancer, you're probably familiar with how big that surgery is. But I got to this place called Walter, and the day after I arrived, the physio came and said, right, we're going for a walk. I thought, well, okay. But we walked around this block, which had a huge hill. It was a big block, you know, a city block. And I had to stop a couple of times, me thinking, gosh, maybe I'm going to have a heart attack. My heart was just pounding because I was pretty deconditioned by this point, you know, the sort of first round of chemo, then the surgery. But she was so confident. I trusted her. You know, so I walked around that block with difficulty, you know, and with stopping to get my breath back, and thought, wow, I could never have done that on my own. I could never have pushed myself. I wouldn't have occurred to me to go that hard, you know. And I was so grateful that day because it made me feel strong again. You know, I didn't feel like this collection of this massive wound in my body and no hair and, you know, not a very, yeah, it was a real demonstration to me of me not knowing everything I needed to know to look after myself with exercise. Yeah, and I stayed there for about, I think I was there for 10 days, and I exercised every day there. And again, I exercised harder than I thought was possible for me at that stage of my treatment. Yeah. I then finished treatment and went back to that hospital as an outpatient and exercised with a physio there. I think it was for 6 weeks. And again, I couldn't possibly have pushed myself as hard as they did. I think there's a video of this. I think there might be a little bit of a video here. So if anybody technical is listening like Jeff, this could be the time to play that video or not. Oh, no.
It's a single leg hip bridge.
Anyway, it's just me doing, oh, look, there I am. Thank you very much. Yeah, that was me at the end of treatment, pretty close to the end of treatment. And, you know, every day they took me further than I thought I could go. You know, reasons for me to exercise now, it's become a habit. You know, it's become a really healthy habit. I really believe, obviously, that the physical and mental are linked. You know, it's not only helpful to me physically, it really helps my morale around the cancer and every other part of my life, because it's, you know, I exercise so that I can live the life that I want to live. You know, on Monday I drove 10 hours back from the country, long drive, 2 drivers, but a long drive, a long time in a car. As soon as I got home, my niece, her husband, her 3-year-old, and another niece arrived. And I played with them for 2.5 hours. We ate. They were all in my house. It was kind of this really big day. But I had the energy to enjoy it. I wasn't just pretending to enjoy their company. I was really enjoying it. And that was one of those points where I thought, I am so glad that I'm fit, because it lets me live the way that I want to live, you know? Yeah. I also find exercise really helpful. For me, I can really have anxiety about doing this cancer thing right. You know, there's that kind of, what my ovarian cancer support group, one of the people in my ovarian cancer support group, which I really love, I'm in Sydney, so I go to the one in the city there. One of the people in that, when I was talking about the anxiety about, you know, gee, if I could just do everything perfectly, maybe I could make sure I'd be okay with this. And she said, you know, that fear is illogical but unavoidable. And exercise is one of the things that helps me transition from, you know, am I doing it right? Am I doing enough? If I've got that kind of mental head on and I exercise, I come out feeling on top of the world. I really do. Yeah, so it's really helpful for I guess it's my perfectionism and anxiety. And I wouldn't say I was plagued by those, but they were a part of me before diagnosis, and they're a part of me now. And the way I exercise now, I actually haven't said what I do. I do work 3 times a week at the strength clinic. It's part of University of New South Wales and the Royal Women's Hospital where I do treatment. Kate Webber is my oncologist, and she was the person who I found out about that through. She works there as well. Glorious woman, Kate Webber. Yeah, so I go there 3 times a week. I do, so that's weights, that's resistance training. I'm trying to really increase my aerobic fitness at the moment. That's the thing that I know I haven't been doing enough of. So I'm really trying to focus on that now. If I'm out of town, like I've just been away for 3 weeks, so I was swimming laps at an Olympic pool, I was walking fast, and I was really lucky there was a horse I could ride because I grew up in the country, so I was horse riding. Yeah. What else? I'm going back to my beautiful piece of paper. Yeah, the other thing, you know, for me, I'm someone who eats for comfort, you know, and I know it's important to try not to put on weight with this disease, with this cancer, and exercise really helps me to eat well. You know, it stops, if I've got a choice between, you know, if I exercise, I no longer have that impulse to overeat. And that's a fairly personal thing to share, I guess, but, you know, I think, you know, that's always been part of me as well. I've always been someone who is quite capable of eating for comfort. And exercise, if I'm exercising, I'm much more likely to be eating well, you know, to be eating the way that is going to be helpful to me, not harmful. Yeah. What else? There's, in terms of motivation for exercise, you know, the reason that the survivorship program at the Strength Clinic at UNSW was so great for me is because I'm booked in there. I'm booked in 3 times a week. I work with a graduate exercise physiologist each time, so they're these fantastically well-educated, you know, fit young people. It costs me $15 each time I go, and so I can afford to do that 3 times a week. But the thing about that is that if I don't turn up, they're fully booked. Someone else doesn't get to exercise. I'm keeping somebody else out. But also I let down the exercise physiologist, you know, the graduate exercise physiologist. If I don't turn up, they don't get to, you know, do part of their study. So that's one of the reasons why I turn up. It's a habit. It's close. I walk there in about 7 minutes. For me, I never feel like going there, in truth. I've always got the, I think I'm too tired. I don't feel like it. You know, I often walk there thinking, I don't really want to do this. Every time I do it, I walk out thinking, I'm so glad I did that. You know, it never fails. Like, it's really important that exercise is a habit for me. Otherwise, I would took, you know, the reasons for not doing it would win every time. The only time I did struggle with exercise was this over Christmas. I did 6 weeks radiotherapy for little spots of recurrence, and the nausea was pretty bad. I cancelled once and I left once. I was working out there and feeling really nauseous. I'd come home from exercise the time before and been sick, the only time I was. And I actually left that time, you know, because they work me pretty hard there, much harder again than I'd be doing on my own. And that particular time, like this last Christmas, I left in the middle of a session. It's the only time I've ever done it. I was in tears. I felt so sick. It was just too much. But I went back, and they were so kind. My God. They didn't make me, I didn't feel embarrassed. You know, they were really sensational about it. And I guess, you know, for me, that's another reason to work. I get so much encouragement from those EPs, like so much. Yeah. And because of them, I really never have been stronger. I've got 2 remarkable muscles these days, you know, and nothing that I want to do physically is a problem. I'll probably have to do chemo again. You know, my disease is still there. It's growing. It's not going too fast. So very interesting to hear Vanessa talk about exercise, perhaps presenting the cancer spreading as aggressively. My CO125 is there. It's rising. I'm pretty sure I'll have to do chemo again probably next year. It'll be the 2nd time. And I know that that's not too bad. I'm 3.5 years in. I've done one sort of, course of chemo, as it were, in that initial treatment. If I have to do chemo again, I'm going to be exercising as hard as I possibly can through it. I'll be going to the strength clinic. They're happy for me to go there. What else? I think I've probably nearly talked for long enough. I do try and make exercise easy for myself. I bought a mini Tramp because if I get to the end of the day and I haven't exercised, I try and exercise 5 or 6 days a week. The 3 days a week I go to the strength clinic are so easy because I just go. They're in my diary, I go. But outside of that, I bought a mini Tramp because if I get to the end of the day and I'm feeling a bit sluggish or a bit like, you know, that kind of lethargy, that maybe just comes with being 62 a bit as well, I can just haul that out from under my bed. Last night I did 20 minutes of a sort of reasonably brisk jog on the mini Tramp. Felt on top of the world when I finished. I didn't feel like doing it beforehand. I rarely do. Unless the exercise is something like horse riding, I pretty much have resistance every single time that I exercise. But what I have is a pretty decent habit of getting through that. And the more I learn about how important it is for the cancer, the more I'm motivated to do it. Just looking at my paper. Yeah, I guess I'd really like to emphasise the kindness of the EPs that I work with. They don't sort of pamper me. You know, they don't say, oh, you poor thing or anything like that. I don't want that from them, but they are kind. You know, and if I'm a little bit demoralised, they are very good at telling me I'm doing a good job and keeping me going. And their expectation is that I will do the exercise, and I meet that expectation. I have to say, I find it, you know, it's really an absolutely wonderful program. I wish I'd gone sooner. Actually, would like to say I wish I'd joined my ovarian cancer support group sooner, you know, but there it is. I'm not going to be able to do this whole thing perfectly, and I try not to beat myself up when I don't do it perfectly. You know, it's like progress, not perfection. I'm just having another quick look at my scrappy piece of paper here. Yeah, I do think one of the most valuable things for me in terms of exercise is how it changes my perception of my situation. I want to live, you know, as well as I can in the time that I have, and I have absolutely no idea how long that might be. But I want to have the energy to live really well. I want to have the exercise, the energy to enjoy my life, and I know how important exercise is for that. Like, not just theoretically, but I have the experience of that, you know, constantly, routinely. Yeah, I don't think I've got anything else to say. I think that's about 15 or 20 minutes. Yeah, so Vanessa, I think that's over and out from me.
Wow, thank you so much, Julie, for, you know, sharing your experiences so honestly and openly, and sharing, you know, how exercise has benefited you. You made some great points in that presentation that I know everyone will take home. And I think the one that stood out for me is that you don't always have to love the exercise that you do. Sometimes you actually hate it, you don't want to be doing it, but that you feel so great after, and that long term it actually gives you energy. So it was just so fantastic to hear that from you. Thank you so much. We do have a couple of questions. I'm just reading what a couple of people have written. One of our viewers has said, I can relate to what Vicky's saying about exercise and making ourselves do it, and we wish her all the very best. So that's just for you, Julie. Someone's asked if we can see the full content of the webinar. Yes, it will be posted on the Ovarian Cancer website in the next week or so. So look out for that. A question for you, Julie. You talked about support groups that you attend. Someone's asking, where can you find them? I'll let you answer, and then I'll also add my bit.
Yeah, it's an ovarian cancer support group. It's run by Ovarian Cancer in the city. The moderator, whose surname I can't remember, Mandy, she's such a skillful woman. I like her a lot. And I'm slowly getting to know, I've probably been 5 or 6 times now. I'm slowly getting to know the other women. This is quite a long answer. Short, to answer the actual question, it's in the city. It's the second Monday of every month. It's an hour and a half. And I found it through Ovarian Cancer Australia. That's it.
Yeah, so I'll just add, thanks, Julie. I'll just add to that. So Ovarian Cancer Australia runs face-to-face support groups every month, like Julie said, in Melbourne, Sydney and in Perth. For those of you not in those cities, we run tele-support groups also once a month. So if you are interested, please call our support line on 1300 660 334, or you can visit our website for more information, but we can definitely hook you up with one of those groups. One last question, Julie, and then we'll let you go. And it was, give me one sec, how do you motivate yourself to exercise on the days when you feel really down and tired?
You know, what I find is there can be 95 or 99% of my thinking going, I don't want to exercise, I think I'm really too tired, genuinely too tired, probably shouldn't exercise today. You know, there can be all of that, I don't want to do it, and there'll be one tiny little thought going, you could do it. And if I take that thought in that moment, that little window of opportunity, that's when I got up last night and got my mini tramp out. There was this tiny little inkling of I could. And yeah, that's the getting up. The other stuff is, like I said, I've got it in my diary. 3 times a week I go to the exercise clinic, and I don't cancel, partly because it lets other people down if I do. How else do I motivate myself? You know, I motivate myself to try and, you know, clothes. I know it's good for the cancer. More and more and more I'm learning about how important it is for cancer treatment, and I want to live. You know, I want to live as long and as well as I can. So there's that as well. You know, it's kind of high stakes, really. You know, it's my life, and I really know how much it also changes my perception. I can be feeling a bit down, and I sort of feel like 3.5 years in, I've kind of got, a lot of the time I feel like I've got my head around this cancer. I don't mean it's great and isn't this terrific, but I feel like I'm learning to live with it. But if I am having a bad part of the day with it and I exercise, I have a completely different mental state afterwards. It really changes my mental attitude, and that's important too. Yeah, so but it's that little window of opportunity. It's that little, oh, I could get up now. It's like if I get up in that second, I will do it. Yeah, that's the answer that I've got, Vanessa.
Great. Thank you so much. And another good point you've raised there, I think, is being accountable to someone, whether it is your trainer, your exercise physiologist, or maybe just a friend. And, you know, once you've agreed to meet someone somewhere, like you said, you're not just letting yourself down, but you're letting them down as well. So, yeah, fantastic. Thank you so much, Julie. Really appreciate your time. There are no more questions for now, so we'll leave it there. So once again, I would like to, I'd like to say a big thank you to our speakers, Associate Professor Prue Cormie and Julie Vickers. We really appreciate your time and the information that you've shared on this webinar. Thank you everyone for being on the webinar, and we really hope that you found it valuable. The recording of this webinar will be posted on our website over the next week or two, and you will receive an email with a link to the recording in the next few days. In a moment, you'll be directed to an evaluation form. If you could please take a moment to fill this in, as your feedback is extremely important to us and will help us to plan and develop future webinars. If you have any questions that you would like addressed, please don't hesitate to contact our information and support line on 1300 664 330. Thank you so much, everyone, once again, and we hope to see you on our next webinar, which will be early next year. Thanks very much. Have a great day.